is Danny Contreras. I'm the health service manager for the County of Santa Cruz. County of Santa Cruz Health Service Agency Clinics Division, and I manage the MAT program at all our county clinics, which we have three, plus our mobile clinics. So we got the Watsonville Health Center, the Homeless Person Health Project, and the Santa Cruz Health Center, which we call Emma-Line. And then we have a street medicine and mobile clinic team.
Awesome. Thank you. So at all three of the sites that you oversee, what projects or efforts have you initiated to break down barriers and reduce the stigma of substance use disorder?
We've had all our team have lived experience, and they kind of give those trainings throughout to all the people in the clinic, registration, front desk staff, everybody. But one of the huge things that we've been doing and implementing is called AVP, Alternative Violence Project. And don't let the alternative violence fool you. That's only about violence, but it's really about breaking down barriers, breaking down stigmas. There's a lot of stigma within addiction, mental health, primary care, and it's really breaking those barriers down for people to be able to see people as human beings and not as a stereotype or the things that people look at them as. And so that's one of the huge things that we've been able to do. It's a very experiential group training, a 3-day workshop. It could be done in a 2-day workshop. And you basically do certain games, what you think are games, and you're having fun. And you have the safe space to kind of explore that during these exercises. And then they process that during the exercise, after the exercise. And it's just a lot of aha moments for a lot of different people.
Awesome. Can you give any examples of what the AVP workshops entail?
Yeah, so I can give a little bit from my own personal background. I was trained in all the workshops as a facilitator inside prison when I was incarcerated. So I was incarcerated for a number of years. Inside prison, there's a lot of segregation, a lot of gang stuff, a lot of prison politics, what we call. And we started coming off lockdown, they put a group of us together in this first time ever AVP group. And so they had an exercise called concentric circle. So there's a circle of us that were facing outwards in chairs, and there was a circle outside that was facing inwards looking at them. So you got placed around people through this circle that you normally would not talk to on the prison yard or have any kind of conversation with, except for some common professional courtesy. After they process it, both of them were like, man, I just realized we got more things in common than we have differences, and despite the color of our skin, we have a lot of things in common. But at that moment when I was seeing, I was like, man, that's cool. Like, we were able to build some relationships in there, and it didn't come back out here to create some violence, right? I was like, I can take this when I get out of prison, and I can use this in the community, whether it's mental health, whether it's addiction, whether it's stereotypes, whatever. And it really gives people the atmosphere to be able to learn and grow in a safe space and break down those barriers around addiction, around race, around gang, around any of that stuff. And I've watched it kind of transform some people's lives, including myself to a certain extent, So it's been huge. I've got all my staff has been trained pretty much. I think there might be a couple that I'm going to get trained. They're actually finishing today another workshop. And I've tried to invite everybody that can, a doctor, a cop, everybody from all walks of life, patients and clients, because I feel like the more they're involved in there, the more people get to see people as people and human beings. And it just builds so much community, and it just breaks down barriers. If I now have a relationship with you, it's harder for me to treat you a certain way or to even do anything violent, And then if we have this relationship that builds rapport, right? And so now I know I can get help. I don't have maybe the front desk staff looking at you a certain way. They're like, nah, that could be my brother right there. Hey, let me get you help. Let me get you to see this drug and alcohol counselor. You need help with Matt, or you need help with housing. Let me get you with one of our case managers. They'll get you set up. It's a different way of interacting with people than the biases and the stigmas that come with addiction, especially around MAT as well.
How have you touched on this a little bit, but how have you adapted it from where you learned it in a prison setting to adapted to a clinical setting with your MAT patients and providers that you train?
So like when I first started, there was a lot of people that didn't want to see the patients. I don't know if it was personal or what, but people had their own stereotypes about what patients were, and how they were treated because of their addiction or them being homeless or being this and that. And so I think that that has getting getting different people like our providers, a psychiatrist, getting different people into these workshops. I know one of the biggest things, especially with providers, they're billing. Oh, I don't want to take them out of the clinic for billing, or they can't see this many patients. But to me, it's an investment in your staff for the long run, right? Because they're going to
Right.
have better connection with their patients. I've not only included our clinic, our mental health staff, our staff that's working with juveniles, and different departments of the county, the community members. Like I got to open it to every single person. So I feel like the more diverse, the better. And it's just going to really enhance everything for the community, for people to get the access to care that they need and save lives. Like right here, we had 120 deaths last year that we know of. And it's 50% were all fentanyl overdoses. So if somebody doesn't feel welcome somewhere, they're not going to go get help, and that could be somebody's dead.
Right.
So like, how do we create that atmosphere that I feel welcome no matter what I'm going through in my life, that I can go there and get some help or support.
And you said that you open it up to your community as well. When you host these workshops, are they within your clinics or do you use community sites to host the workshops?
So we've used different community sites. Sometimes it's been a church. Sometimes it's right now they're using some, I think, a Quaker meeting hall. We reach out to whoever has an open space that'll let us use it, and we get in there. And it's cool because we tell those, whoever's there, their organization, hey, you take some of your staff too. Invite as
Right.
many staff as you want. And the cool thing about it is, like, there's three of them. There's a basic, an advanced, and there's a T for T, tips for trainers. So once they go through all three, they give them the curriculum, and then they can start facilitating them themselves, right? And then they can become of a bigger community of doing these things. So yeah, we just open it to everybody, and whatever space will open it to us, we're there.
Awesome. And you talked about the three different levels of the program. How long approximately does it take to go through all three so then they can start training as well?
Yeah, so it just depends on how fast you want to do it. So,
Okay.
like in the community, they have certain times based off of their own schedules and stuff like that. So,
Mhm.
like right now, we just did a basic. It's finishing today. They're gonna run another basic, and then the facilitators that are here that are available, they're gonna try to run an advance. So it could be real quick. They also offer these workshops in the majority of the California Department of Correction prisons. So you could go inside a prison and go to every single one and get trained as a facilitator, and then you start kind of somebody you're under like somebody's wing as you're facilitating until they let you go out and fly on your own with other facilitators. But it could be really quick. And the neat thing, there's guys that are in prison that have been sitting there for 20, 30 years, and they have worked on themselves, uh, and they're like master facilitators.
Yeah, absolutely. I know you described a lot of benefits that the AVP workshops have that you've seen so far. Specifically, in your opinion, how have these workshops helped to break down barriers and reduce stigma and substance abuse within your own community?
People are able to go in there and deal with their own biases, their own belief systems that might be faulty, or they might not understand somebody else. They don't have no empathy. It gives them empathy. You're getting put in somebody else's shoes without even knowing it, and then you're like, wow, So those are huge. That could be huge for a doctor that doesn't want to see nobody that's on a mat, or they only see patients that are not doing good. That could be life changing. I've seen doctors, that we have got some similar trainings around them, and they to turn it all the way around and went from being opposed to doing any type of mat stuff to let's all do this. Let's get
Right.
everybody going on. They start becoming the champion for the mat program and giving people services. So it really does break down barriers and belief systems. That you hold that sometimes we don't know that we hold. That maybe other people see it, but we don't know.
Right, absolutely. From a patient standpoint, have you seen an increase in comfortability or just an increase in patient engagement with your providers and clinical staff since doing the AVP workshops?
Yeah, I think so. You probably can go question all my staff, and they'll probably all have their own little story about stuff that they learned from there and they pulled from there and how it's affected the patients. Today, one of the groups today when I went there earlier, one of our patients is facilitating.
Oh,
So
awesome.
that was pretty awesome, and
Yeah.
that patient is taking off and learning how to do everything and gonna like going gun ho with it. So that's creating more opportunities for people, right? And it also creates opportunities for jobs too.
Hmm.
If you wanted to step in this field, like, you know how to run groups. Like some people don't want to run groups. This is giving them so much tools and skills. They can go up there and run an SUD group, different groups, psychoeducational groups and whatnot. So there's just so many benefits that come along with that.
We'll switch gears real quick to what we talked about earlier with overdose prevention. Are there any tools that your sites have utilized to combat addiction and the overdoses that you're seeing in your community?
So we give out Narcan to everybody like it's candy. As much as we can get, we're giving it out to everybody. We do educational things in our clinic for all our staff, for our patients in our groups, our shared medical appointments. All our patients that are doing well, we have a tiered system. So from like tier 4 to 6, and sometimes 3, depends on how they're doing. Uh, we will start training them. We have a curriculum, and we start giving them like peer coaching, case management 101, and we do this class with them for a while, and we give them all the stuff that we've learned basically, and they're able to use those things, and they come through our VIP process, our volunteer intern program process, so they come under the county that way, and they start working shifts in our local syringe service program. So giving back there, they're learning how to set up kits, learning how to talk to people. They're learning best practices around harm reduction, motivational interviewing. How to give Narcan, how to show people how to give Narcan. So there's a lot of people with lived experience that are in those things, but they're also sitting and helping us facilitate or co-facilitate groups. We're kind of giving them, let's go out and do outreach together, and then going out to the community. Did we get requests from different organizations and sites, whether it's a clinic or it's a drug program or anything, or a community group that's meeting together to kind of help people out in the community? Can you come give us a Narcan presentation? Sure. So we'll set up, either it could be a doctor, could be me, one of the other managers, could be one of my case managers, and our peer support specialists, our patients that are doing well, and we'll go up there. They might share their story, and like we're doing a couple things with that, right? We're educating the community. We're also breaking down these barriers, right? And we're letting them know, like, look, here's somebody right here. This is a human being right here, and look where they've come with the support they've been able to give. So the support you give back to somebody else, you could save somebody's life. And some of our patients have overdose, so they might share those experiences in those meetings or those trainings. So we get a lot of requests to do Narcan trainings everywhere, and we do a lot of those. We even did school assemblies. We didn't do the specific Narcan training, but we gave them education there around that and how to get it and where to go, for their parents and stuff like that. And it's been pretty cool. I feel like I started in 2016, and I feel like from there, we started with like one provider doing MAT, and then we went to like 30 providers within a couple years, and it went from me to, I have a team. I don't even know how many I got now, 14, 20 people across all the clinics, plus all the interns, and then we have college interns too. So the college interns, I put them with with our patients that are doing well, and they're learning at the same time, right? So they're getting paired together, they're learning about each other, and then I also send them all to AVP too. you know. So they're building community, and they're learning about stigma and all that kind of stuff. It's pretty awesome.
Really, truly amazing work. This sounds
And then,
awesome.
and then the other thing we do within that is we show them the pathways if they want.
Right.
Like, this is how you can be a certified peer support specialist. This is how you become a drug and alcohol counselor, do CADTP. We walk them through the process in those classes and show them. And when people start getting the information that they didn't know, it's like, oh, I didn't know that. I could do that. It creates things, and so they can use me as a reference now. Not that they're a patient, but that they were interning here. You know, I show you how to do it. You do good. Shoot, I'll write a letter, or you tell them to call me. So a bunch of our interns and our patients interns have gotten jobs just off that, and then I can sign their hours off from what I'm having them do here as they're learning this education around facilitating groups, doing outreach, working at the needle exchange. Doing intakes, showing them how to do certain surveys. And just teaching them a bunch of stuff. The EMR, like, now they have a whole history that they could put on a resume that's going to get them a job.
Just opening those doors is an amazing feat on itself. Thank you so much, Danny, for sharing all of this. I'm really excited to see the end cut of this video. I feel like there's a lot of great information for our grantees to hear. I'm excited to spread the word about the AVP workshops. So thank you so much for sharing.